The session is being recorded. We'll just wait for this. It is exact 9:30 by my clock. We'll just wait for one more minute and then we'll start. Sir. So shall we start, sir?
Yes.
A very good morning to all the friends and followers of IIT Hyderabad. I welcome you all on the behalf of the Institute with the permission of Institute Director Professor B S Murty. And it is indeed a great occasion for not only the Institute, for the country, that we could come up with such an interesting and interactive portal to serve the nation. And as our objective will be clear at the end of the session, that we wanted to even scale it up to the global level. So now, without taking much more time, I would invite our chief guest for the event, Professor B S Murty, Director IIT Hyderabad, to deliver the welcome address, please.
Good morning, friends. It's a great day indeed that IIT Hyderabad, with the whole team working very hard for the last 2 months, more or less, has come up with this wonderful website, which not only gives just updates on the number of cases, number of vaccinations, and the tests in each state of the country, but also gives predictions. All of you are aware by now that there is a national level team under the leadership of Professor Vidyasagar has been working on the SUTRA model, and they have been coming up with wonderful predictions. Today, after we inaugurate this, and when you click on the website, and you would be able to see the predictions until the next March, 2022 March, how the predictions are, and how the predictions were comparing with respect to the actual cases. You would see the
Professor Murthy, you have gone into mute somehow.
I'm sorry, I don't know. Automatically it happened. Sorry, friend. So you also are aware that the necessity for us to launch this has happened by the middle of September, when the website, which was being maintained by a bunch of young people, decided to stop their activity by the 31st of October, and they declared it. Quite a large number of people within the country and outside the country use that data for their model predictions. And then immediately, Professor Vidyasagar brought this to my notice, and I said, let us take it up. This, we not only feel is help to all the researchers who are working, but also to the whole society. It is going to be a boon. And with that intention, we immediately started forming a team, and under the leadership of Professor Bhimajan Reddy, the whole thing took a wonderful shape. Within just hardly 3 weeks, they are able to come up with this kind of a website, which has been repeatedly tested again and again before they wanted to launch. And we are glad that today we are launching this website. I'm sure the whole country gets benefited by this website, not only in terms of just the data, but also in terms of what is there in store for us in the future in terms of the predictions that the SUTRA team provides. I'm really delighted for all the hard work that is done under the mentorship of Professor Vidyasagar, under the leadership of Bhimajan. And thank you very much, friends, for this wonderful endeavor that you have taken in the interest of the country. And I'm delighted to inaugurate this particular website. Thank you very much.
Thanks a lot, sir, for your, as always, word of encouragement for us, which act as a fuel for us to do the great deed again and again. Now, I request Professor Bhimajan Reddy, Chair for this Computer Center at IIT Hyderabad, to throw some light on the technical aspect of this portal, please.
Yeah. Good morning, one and all. Before I go further, let me first thank all the people that are involved in this particular effort, especially Professor Vidyasagar, who really wanted to make sure that we continue the effort which was initiated by COVID-19 India team. So he really wanted at any cost we should continue the effort. So we also felt that it is really a noble cause to participate in this particular effort. And thankfully, some of the students led by Anurag from our Gincana team really passionate about doing something for the institute to start with. Then I felt that they can also do not only at the institute level, they can also do at the country level and provide these kind of outlets. They really jumped onto the opportunity, and most of the students who are part of this effort, including volunteers from Computer Center, are here in this particular call. So I would like to really appreciate their dedication in coming forward and spending a lot of time in spite of their other schedule that they have as part of the courses and other they do at IIT Hyderabad. And also I would like to thank our director, sir, for encouraging and providing whatever is supported financially in launching this website. Unlike the original team, which kind of went on into the crowdsourcing model where they deployed on GitHub to make it as a zero cost model. So we decided to make it in-house development with financial support from IIT Hyderabad, and we hosted it on public cloud so that it can scale up to a large number of user requests per day or per month, whatever it is. The results are very encouraging. In the last 1 month, we have seen the website as serving 18 million requests from over 2.7 lakh people spread across the globe. While the predominant number of people are from India, like 91%, we see good amount of the traffic from US, Canada, Middle East, and also from Singapore, where I think most of our NRIs are there. Again, I would like to place on record before I conclude the effort by all the student members, and maybe, sir, shall I ask them to say hi at this time, or you want to?
Sure, please.
I see Rahul is here.
Maybe at the end we should have all of them on the screen so that we can have a photograph.
Yeah, I was just going to say, let us show that contributors page, and then we can just ask all the participants to say hello.
Yeah, that's all from my side, sir. Thank you, Mitali, for organizing this thing. Yeah, that's all.
So I'm just going to share the screen of contributors so that they can all just say hello.
Hello, can you hear me?
Yeah, so I'm just going to click this page. So here is a list of contributors. So can you just please go in this order? What about Anand Shai?
Anand, are you there? Can you switch on your camera? Thanks a lot, Anand. Thank you very much. Great effort.
And
Anurag, can you please?
Yes, sir. Yes, sir.
Hi, Anurag.
Hello.
Wonderful job.
Thank you. Thank you, sir.
Wonderful. We are grateful to you.
Then Imtiaz.
Imtiaz, can you switch on your camera for a minute? Are you there? Maybe we can come back to him. We have Karthik.
Yes, sir.
Karthik, thank you very much.
Thank you, sir.
Thank you. And then we have Krishnan. Dhanush. Dhanush, are you there?
Yes, sir. Hello.
Thank you, Dhanush. Thank you very much. Pradeepa Kumari, are you there? Pradeepa?
Yes, sir.
Thank you, Pradeepa. Great job.
Thank you.
And then Rahul Teja, as usual, he's always there. Smiling face. Thank you, Rahul. Great job. Rupa. Thank you, Rupa. Wonderful work.
Thank you.
And Sharat Chandra. Sharath. Where is Sharath? I can see you there. Thank you. Thank you very much. And great job done by all of you. And keep doing it. Please remember, okay,
Yes.
launching anything is one thing, sustaining it is another thing. Okay, and sustaining needs more passion. And please maintain this passion and ensure that. Please remember, you are not just doing a small job. You are serving the whole country and the whole universe to the whole globe, who are all looking forward to such a site. So keep that in mind. Then you will realize the value of the contributions that you are putting in. Okay, amazing contributions of all of you. Thank you very much. I have no words other than just saying thank you. And please, and that's a problem with the language. Please excuse me that I cannot go beyond that word called thank you. But it's a great job. Thank you very much. Over to you, Mitali.
Now I request Professor Vidyasagar if he want to present some other silent features of the portal to us, please.
Yeah, thank you, Mitali. I just wanted to show the home page. As Professor Bhimarjan mentioned already, when this website, covid19india.org.
The volume is low, please.
Yeah.
It is fine for me.
Kindly increase the volume, sir.
Yeah, I'm just bringing it a bit closer. Just 1 second. I'm just wondering if it is in the wrong.
We are able to hear you well, sir.
Okay.
Yeah, it is fine.
Will you please raise the volume?
I think you are the only one who is having problems, sir.
Maybe there are some network problems in some areas of the city.
Correct. Nandakumar Garu, we are able to hear much better, sir. Okay, maybe you should come closer.
I know. See, there are some network hassles.
So I'm sorry for that.
I hope I am clear.
Thank you. Thank you.
Am I clear?
Yeah.
We are able to hear you well, Nandakumar Garu.
Okay.
So the
My
point
phone is perfectly okay. I've been listening for the last 10 minutes. It was perfectly all right. All of a sudden, there's a slump.
Yeah.
Maybe Nandakumar, you can try reconnecting and see whether it is going to help you.
Okay. Vidyasagar Garu, go ahead, please.
Yeah, I was just going to mention that when we designed this website, we initially decided to retain the look and feel of covid19india.org because the users of that website were familiar with a certain user interface, so we did not want to change it. But we did actually make a whole lot of other modifications. For example, we wanted to make it a one-stop shop. So as you can see, we added the link to our own prediction. This is the SUTRA model. I'll go to that in just 1 minute. Then a couple of public databases. One is the CoWIN database, which is the vaccination database of the government of India. There is vaccination data available on the website also, but this is not into great accuracy. For example, Maharashtra, 12.1 crores. If you want to drill down a bit more and get some daily details, things like that, you can go to the CoWIN database. And equally important is the so-called INSACOG database. It is an activity funded by the Department of Biotechnology, and it is about the variants in India. So, of course, as of now, there's only a very small number of suspected Omicron patients, or something like 30 to 40. But as time goes on, there will be more of them, and the prevalence of these variants will be found in this database. And there are, you have already seen about the contributors. And if you want, people can send a mail. If you have suggestions, please send mail using this icon. And if you are interested in data, you can click on this icon. So if you're a researcher and you don't just want to look at the graphs, let me go back to the home. If you don't want to just look at these graphs, but you want to download data, you can go to this drum icon and you get a lot of statistics, which you can use to make whatever analysis you want to. Now, just as the last item in my remarks, I wanted to highlight our predictions. We have been giving predictions throughout, but now that the Omicron variant is here, there are other reasons to get very concerned about the future. So this is actually the work done by the so-called SUTRA consortium, and IIT Hyderabad is a part of the SUTRA consortium, but is not all of it. So here is a list of the 5 people who make up the SUTRA consortium. Dr. Anurag Agarwal is the director of the IGIB, the CSIR laboratory in Delhi. Professor Manindra Agarwal is from IIT Kanpur. Dr. Pramod Garg is the director of THSTI, which is a DBT laboratory in Faridabad. Lieutenant General Madhuri Kanitka, now retired from the army. She is now the Vice Chancellor of the Maharashtra University of Health Sciences. And finally, myself. So we have given a whole lot of predictions, and the full PDF file is here. I don't want to go through the entire presentation. So just to make it easy for you to follow what is happening, we have extracted the last slide in the presentation. And what we have done is made some assumptions about the Omicron variant, because it's very early, there is not reliable data available just yet. What is the extent to which it escapes immunity? What is the extent to which it escapes vaccination? We don't know yet. So preliminary indications are that it doesn't seem to escape immunity much, but the vaccination it could escape. So we have made 3 scenarios, as you can see here. Optimistic scenario is that Omicron does not also bypass vaccination. So if you had a 60% reduction in your likelihood of catching Delta, you will continue to have 60% protection against Omicron as well. Intermediate scenario is that the 60% protection against the Delta drops to 30% protection against the Omicron. And the pessimistic scenario is you have no protection. All your vaccination protection is gone and you are now completely vulnerable to the Omicron. The only thing protecting you now is the prior exposure to the Delta variant. So in terms of these 3 scenarios, we can see that under the optimistic scenario, we're forecasting a peak somewhere towards the middle or end of February, and the peak will be something of the order of 1 lakh daily cases per day. Under the intermediate scenario, somewhere around the early part of February, and the peak will be about 1.2 lakh per day. And in the pessimistic scenario, where we assume that all the vaccination protection is gone and only the natural immunity remains, we are expecting the peak to come even earlier, near the start of February, end of January, and the peak is now about 1.5 lakh cases per day. The point I want to mention, though, is the number of cases does not necessarily translate into the number of hospitalizations. We have deliberately not made projections about the number of hospitalizations because there is not enough data to do that. The data from South Africa says that hospitalizations are very low, not commensurate with the number of cases. In other countries, we have to wait and watch. And similarly, in India, we have to wait and watch. But in any of these scenarios, compared to the fact that India went through a peak of 4 lakh cases per day during the second wave, and the hospital infrastructure has been massively upgraded since then, this should not be a problem. And as I was mentioning to Professor Murty, things like schools and colleges should be reopened because younger people generally are not so vulnerable to the serious illness compared with others. So that's pretty much all I have to say. And if people want to ask some questions or comments, please feel free.
Sir, can we Go
First
ahead
of
first.
all, thank you, Professor Vidyasagar. You have
Thank
given
you.
a lot of positive energy to all of us, positive, positive news to all of us. Okay, that is the most important. Particularly heading a institution with a lot of young students, I am now at least very clear that yes, we can have complete offline classes without any problem. Thank you very much.
Thank you.
Sir,
Yes.
can we proceed with the formal launch of the portal so that we can say that like from like this moment this portal is for the public use, and then we can leave the forum open for the Q&A, sir.
So do you want
So,
me to
sir,
open the website, Mitali? What do you want me to do?
Shall
I have some
Oh, okay.
virtual curtain raising, sir.
Okay, very good.
Okay.
We'll leave it to you then.
Ma'am,
So,
am I audible now?
yes, sir.
Am I audible now?
Yes, sir. You are audible, sir.
Okay, yeah. There was a slump for a few minutes, but anyway,
Okay,
the
fine.
network is
So
okay now.
we are proceeding with the for virtual formal launch of the event, sir.
All right.
And then after that,
Okay,
we'll
go ahead.
yeah. So, Professor Murthy, can I go ahead, please?
please, madam.
So, over to you, sir, for permission.
Yeah, do I need to click on this? I cannot click, right? You have opened it.
So you can give a
Yeah,
permission, then I'll click.
my suggestion is if you want, I can possibly open this. You can stop sharing.
Sure,
I
sir.
have the PPT with me,
Sure, sir.
so that it becomes easier for me. Okay.
I think Mitali has some animation to cut the ribbon, is it?
No, I think the same thing you have sent it to me, right?
Yes, sir. Yes, sir. It is
So
the same
if you have
thing.
sent me the same thing, then I am
Yes.
also
Let us just put it
able
into
to
the
open.
presentation mode,
Okay,
sir.
good. I will just go. Yeah. So now, are you able to see this, friends?
Yeah.
Yes, sir.
Yes, sir. Just put it to
Okay,
the.
so full screen mode.
Yes, sir.
Okay, I'll go to the next slide. Thank you. Thank you very much, Mitali. Wonderful. Let me
Thank you,
also
sir.
click on this.
Yes, sir.
Yeah. So the website is open for all of you friends now. I hope you are able to see as I scroll down. It shows all the states data, including the vaccination doses administered so far, confirmed cases, active cases, recovered, deceased, and tested cases. It also gives you a kind of a diagram of the whole country where which regions have more number of cases and things like that. It also gives you links to the INSACOG and then CoWIN here, and also to the SUTRA predictions, particularly the post-Omicron predictions, and wonderful job. Thank you once again, friends, all of you who have worked day and night to make this site. And please maintain it very well, okay? Now it's the reputation of IIT Hyderabad in the hands of all of you. Keep that in mind. Thank you very much. So let me now stop sharing.
Thanks a
over
lot,
to you.
sir, for
Over to
your.
you, Mitali.
Yeah, thanks a lot, sir, for your kind words of encouragement and the time and all the motivation to give to the team to come up with yet again and again something first in the country. A very thank to you, to Professor Vidyasagar, to Professor Bhimarjun to lead this initiative. May I
I think before you take up any questions, I would request all the people who are joined this
Yeah,
event
I was
here
about to request that.
to have
For
the cameras on so that Mitali can click a photograph.
May I
Please,
request all the attendees to please switch on their camera so that we can capture
just,
this moment with all of you?
just for 1 second at least, please, I request you. I can see our dear madam switching on. I can see some Prasad there, Dhanalakshmi, Isha, all of you friends, please. I hope you are all there. The problem with these online meetings are you may not be there also.
Anyway,
Sir,
I am
one
there.
problem,
Okay,
one
thank you.
problem that sometimes people face is when they switch on the video, their bandwidth
Bandwidth goes
up.
down. That's why I'm asking you just for 1 second until she clicks, and then after that you can possibly switch off your camera.
Vitali, I hope I'm audible now.
Yes, sir, you are audible and you are visible. Thank you.
Thank you. I appreciate
Okay, Mitali, I think you can go ahead. I think
Yes, sir.
we have at least half of them there.
Yes, sir.
Thank you. Yeah. Thank you, friends. Thank you very much.
Thank you, all of you, for
Now,
joining us.
now, Mitali, you can take up possibly some questions.
Sure, sir.
Mostly the questions will be for Professor Vidyasagar and Bhimarjun. I'm only a facilitator, whatever it is. So
No,
I'm
you're
just
also
helping them.
you're both a felicitator and a facilitator, I suppose.
Yes.
So,
Yeah.
yes.
Here we are kind of putting our IIT Hyderabad
True,
at the front. Yeah.
Thank you. So
Mitali,
now, any questions from anyone?
Yes, sir.
this is Purmanad.
So I have one request to the audience, and we'll take most of the questions which comes to the forum. So can we go one by one? You can just raise the hand, and then I will just make it to flow a sequence, follow the sequence. So Kurmanath Garu,
Kurmanath garu, go ahead.
Namaste Andi. Congratulations Andi, such a wonderful initiative.
Thank you.
How periodical is the prediction space? Is it live or weekly or monthly? And that is one question. And no, there are a couple of private initiatives in COVID tracking. How this particular initiative is different? How the information to this system algorithms, is different from others?
Yeah, I think Vidyasagar garu, you are the right.
Yeah, so we run the predictions every day, but they don't necessarily change very much every day. So we update the website only when there is a substantial change in the prediction. So for example, before the Omicron variant, the predictions were very flat. They were going down quite nicely. And with the post-Omicron scenario, it has gone up. As and when we find out more information about the ability or the inability of the Omicron to bypass the immunity caused by prior exposure to Delta, those curves that I showed you can go up or down. So as soon as we find out some reliable information, we'll update that. And whenever we see a noticeable change, we will update the website. But the predictions themselves are run every day. Now, in terms of other initiatives, I guess I'm not really competent to comment on that. The only point I would make is that if you go to this website called Worldometer, the Worldometers, that is the worldwide website that gives the statistics about corona in all the countries of the world. And if you look for India and scroll down to the bottom of the page, you see that only two sources are given from India. One is the Ministry of Health and Family Welfare website, and the other one is our website. So I think World of Meters obviously considers us to be, along with the MOHFW website, the most reliable website for statistics about India.
One supplementary question, Andy. Are you going to physically feed the data to the system, or it crawls the internet and gathers information to improve or update the curve?
Well, it's a combination. So I'm going to ask Rupa to answer that question if she's not too shy.
So right now we are feeding manually. Only for vaccination data, it is populated automatically using APIs. But rest of the data we are populating manually. Like we are updating manually.
Thank you.
Did it answer all the query from you, sir?
Yes, Mitali.
Yeah. Now I request Prasad Garu to please raise his question, please. Prasad Garu. Prasad Garu, you can go ahead, please.
Sorry, there are two Prasads.
Yeah, this is Prasad
Nichanamatla. Prasad Nichanamatla has raised a hand.
And yeah.
Okay, then you can go to the next person in the queue, maybe.
We are not able to hear you, Mr. Prasad. Maybe we'll attend some question and then get back to you.
Okay, can I go ahead, Mitali? This is Prasad Bose.
Yeah. Please go ahead, sir.
Sir, anybody can answer. Like, So you have started a website, but for layman or common man. So how like easy it is to understand this website? So are you planning in languages or for common man to really understand? Because this data, graphs, and all the statistics probably learned person can understand. So is there any effort, or are you going to upgrade it, sir? Thank you.
Actually, what our experience is that most people look at only most people look at only two things. One is they look at, I'll just open their website if I may, so you can understand what I'm talking about. So most people, I'll go to the home. They look at these graphs. So for example, say for India, they're very interested in the daily cases or their particular state, whichever it might be. Okay. And then the other one they're interested in is the number of vaccine doses and the number of test positivity. So these are these are just graphs. So you don't really need a multilingual
Sir,
interface. I think
I want to interrupt here. And if you look at the bottom, left bottom, where you see English, can you see that, sir? On the left bottom.
Yeah. There is
Click on that, it is available in, I think, around 10 Indian languages.
Yeah, I was just going to highlight that next.
Can you go to Telugu, sir, if you don't mind? Click on that and put Telugu. Yeah, so that people can immediately see what changes they find.
You can see ధృవీకరింపబడినవి active కోలుకున్నవారు మరణించినవారు and so on and so forth.
So a person who can read the language can see, definitely.
Yeah.
So that's good. Of course, graphs will remain the graphs because these are PDF portions. I think they are cut and paste directly.
Yeah, that's right. Now, the reason why I mentioned it is that the graphs are still labeled in English only because we don't want to generate so many graphs, but the data
you can see Mottam Lekka, Rojwari Lekka, they are also written there. So that also one can see it.
Yeah, that's right.
So to some extent, language is incorporated.
Yeah.
Any other questions, Prasad Garu?
I think this answered my question. Thank you.
Thanks for joining us. Do we have any other question from anyone in the audience?
So if you don't mind, Vidyasagar Garu and Bhimarjun, I have another meeting. I will take off.
Thank you very much for coming.
Okay, sir. Thank you very much.
Thank you very much. Once again, great job. Great job.
Thank you, sir.
Flag high, please. Thank you.
Do we have anyone in the audience with a question, please?
So the other Mr. Prasad says is trying to reconnect.
Nandakumar Garu?
Ma'am, I've got all the information I wanted.
Okay, sir. Thank you, sir. Thank you.
And anyway, I just want to remind you once again that there is a mail icon on the website. If you have queries, comments, suggestions, please use that. Even though the press meeting is over, that's perfectly fine. You can still ask your questions afterwards.
Okay. Thank you, sir.
Do we have any questions from audience, please? Otherwise, we can anyhow the website, the portal itself is a quite interactive portal, and our team is readily available to support the country. So if we do not have any question, we'll declare this session closed, and a press list will be followed post event, so that you can get a much detailed written information, official record from our side.
Sir, there is one query for you in the chat window here.
It says Omicron scenario, but I actually presented that already, but it is there in the website.
Are you representing it, sir?
No, I'm not going to present it again. I've already presented it once.
Yeah, maybe you can just show Mitali the page where one can get
Yeah,
the
I
data.
just wanted to say, you just go and click here on post-Omicron prediction, and that will take you there. Okay. So all the full, if you click on this thing, you'll get the, you can
I
get a
think
different,
Sir
it
Gayatri is
opens in,
asking one question
it
related to
opens
the
in a new window.
age-wise segregation of cases.
No, there is not enough information to have an age-wise segregation, because that will be pure guesswork. So we don't want to get that down. So, oops, I think I did something very foolish.
Does the website has approval of Ministry of Health and funded by whom? That is another
Beg
question,
pardon?
Prasad.
No, it's funded by nobody other than Professor Murty.
IIT
Yeah,
Hyderabad.
yeah,
Okay,
as
so
it was.
now I see the question. Is there any age-wise segregation? No, because you see, there is not enough information to know how the Omicron variants affects different age groups. So we're not going to go there. Does the website have approval of amount? No, we don't need anybody's approval. We're using public domain data, and the SUTRA projections are made by the SUTRA consortium. Is it funded by MOFHW? The government of India has been extremely benevolent to us by giving us zero funding thus far.
But sir, we are getting the data from Ministry of Health and also from CoWIN.
Yeah, we use the Ministry of Health website, but that is public domain data.
Yes,
I
right.
don't consider that as funding us, right?
Okay.
We're just accessing it as a kind of a cross check on the state-wise data that we are populating. But in terms of this work of all these contributors that you have seen, that is purely funded internally. And similarly, as Professor Bhimadin Reddy has mentioned, the previous website opted for a no-cost model, which actually did affect performance a little bit. We decided to use the cloud, which would give far better performance. And for example, if we decide to go for more features, will not be constrained by bandwidth. So all that cost is being borne by. Can you say the predictions have the government endorsement? No. Please make it very, very clear that it is a group of academics. The government could not care less. Please put that. I'm telling you very, very bluntly.
So
The
all these
government has
predictions, sir, you want to highlight about SUTRA consortium. Yeah, it is a SUTRA.
Yeah, it is not a government endorsed initiative at all. They are not endorsed by the government. We are ready to share our predictions with the government if they care to listen. I'm being very blunt. And if you want to put it, please go ahead. I have no problem. But please do not say that our predictions have the government endorsement, because that would be a false statement. They do not have any government involvement at all.
Anybody in audience has left with any query with them, please?
Okay, I think that seems to be all the questions.
Yeah, and anyhow, there's one more query, sir. How this help to state medical and health department in their planning or action?
Well, so the point is that we can actually prepare more detailed scenarios for individual states if they are interested. In the past, before the outbreak of the Omicron, the SUTRA consortium helped the state of Uttar Pradesh to analyze their responses and also to prepare for any possible future outbreaks. So, if any state in India wants to approach us, I mean, either IIT Hyderabad alone or the SUTRA group, to make prognostications and plans for their state, we're always ready. But again, let me repeat once more, the initiative has to come from the state if they want us to do that work.
We'll wait for 2 more minutes if we have any question from someone. Anyway, as Professor Vidyasagar and Professor Edigaru has already told that the portal is interactive. There is a icon there. You can directly write to the team and they will get back to you. So even if you miss anything to ask in this session, we are readily available to take your questions. And this session recording will be placed on the IITH YouTube channel for a widespread of this message. I guess we do not have any more query with us. With your permission, we can declare the session closed.
Yeah, I think we can close. Thank you very much. Thank you everybody for coming. Thank you, Mitali, for the excellent organization as always. And,
all right. Thank you, Mitali.
Thank you, Mitali. Yeah. Thank you all. Bye-bye.
Thank you all.
Thank you all. A great job done for the team.
Bye-bye.
Yeah. Have a good day. Thank you all for joining us.
Thank you.